Hi, this is Coach Gogo again, and I'm here with Dr. Akinyemi of Alpha Allergy and Asthma Associates again, and we wanted to talk about this question because I think is important. And the question is, what makes allergists different? And that's apart from the obvious, apart from the fact that they're allergists, so they have specialized and additional training in the areas of allergies, asthma, and immunologic conditions, and the intersection with sinuses and all of that. So, Dr. Dejana, thank you for this time, and let's dig into this question if you don't mind.
Sure. So as you stated, obviously there's a specialized training, so we do learn a lot more in depth about allergies and immunology just as part of our training. So I think one of the important things to remember is that when you're seeing a specialist, any kind of specialist, that you are seeing someone who sees the condition that you have in larger quantities. So sometimes if you see your primary care doctor, they know and they can recognize possibly that you have a condition that may be allergic or not, and they may decide to try to treat you there. But when it's important to refer to a specialist is when it's maybe not clear, but also just getting to see someone who sees a lot of patients with your similar problem. And also, the part of the training that we have is very in-depth learning of the immune system. So we think about allergies from a different way. We think about how the whole process of how an allergy becomes an allergy and have a really in-depth learning of the immune system. So that's really helpful. So that's one of the benefits, or one of the many benefits that we can see, or that, of course, I'm biased, but that I think is important to
Sure.
see a specialist in our field.
Okay, now in a previous meeting that brought this question to my mind, Dr. Erica Sima was talking about how the immune system is vast. Actually, in her words, right? The immune system is vast, and that not all of it is relevant to allergy, to allergic conditions. And could you talk about that question of relevance to allergies and what it implies for me, as a patient, for instance?
Right, so the immune system is it's a big system in our body. When we think about all of our different systems from our high school biology class, we learned about all these different systems, and then the immune system is a huge one that crosses many specialties, actually, including gastroenterology, rheumatology, and cardiology, and lots of other specialties. But as an allergist, we're able to focus on that aspect that's related to allergy. And so a lot of times people might come in and say that they're having some sort of immune reaction or something with their immune system that they think is allergies, and it might not actually be. But part of what we are trained to do is to tease out that portion that is related to allergy, or might be related to allergy, and evaluate that.
Okay. And we had in the sort of pre-work, you talked about something that I thought was really important, where you said there's often a difference in how you investigate allergens and interactions and medications as specialists, which was fine. But a deeper idea that I want you to address is the idea that sometimes we think that we're experiencing a recurring issue, and we're dealing with it in a one-off way when it's actually an underlying condition. Can you talk about that for a second?
Yes, so as I mentioned, when you go to a primary care doctor, or even, and actually a lot of patients don't have primary care doctors, or they see them once a year, so they might end up going to an urgent care or somewhere else where they get seen for something that seems like an infection, let's say a sinus infection or bronchitis, and they're having these episodes, and they're getting treated maybe with antibiotics, maybe with steroids, but they're looking at it as this one episode, or maybe an episode that's recurring. But when you see an allergist, then usually we're able to put it together and look at the big picture of the pattern of your symptoms, how long it's been going on, and even the triggers, things that when it gets seen in a very narrow scope, for example, during an urgent care visit or even a primary care visit, it's not looked at the same way. So they're able to treat the episode, but then in terms of looking at the cause and preventing future episodes, that's where I think the allergist has a special point of view. And even just the first point that you mentioned, that we can, with the medications and the different treatment options. So let's say we all agree that yes, it's allergy. You definitely want an allergist to be managing your medications for your allergic diseases. We have a broad understanding in terms of picking the best medication, the potential side effects, and just newer options that maybe your general practitioner wouldn't be aware of.
Okay. Well, so that's it. If you've wondered what makes allergies different, why should I consider a visit to an allergist near me, then you just got some answers. If you have additional questions, then you can visit us at alphaallergy.com, or also on Facebook at facebook.com/alphaallergy. All right. Well, thank you, Doc, for answering our questions, and I look forward to continuing this series with you.
Thank you.